Yes.
Okay.
Yeah, we
All
have
right.
to get through. Okay.
That's true. We do. All right, everybody. Well, we're so thrilled that you joined us today for the orientation. Just to recap, this is the orientation for the Recuperative Care Learning Network model that we're currently using in LA County. We're going to have a lot of information coming at you today about our experience in LA, as well as what the next steps are going to be for both San Diego and Alameda counties, which are the two future homes of the next learning networks in the state. So we're very excited about that. My name is Julia Gaines. I think I know most of you, but I'm the Senior Medical Respite Manager for California specifically for the National Healthcare for the Homeless Council. And my work is primarily in our special initiative, the NIMARC, which is the National Institute for Medical Respite Care. I also lead the LA County Recuperative Care Learning Network and will be leading the Alameda County Recuperative Care Learning Network. So, and I've also worked the last 5 years as a recuperative care provider myself. So very excited to be here, and I'll introduce Pam. Pam, would you like to go ahead and say hi?
Hi, everybody. Thank you so much for joining. And I think that I know most of the people on this call. I've been consulting with NIMARC since January of 2022 when CalAIM launched. And I led the LA Recuperative Care Learning Network for 3 years. We had our initial funder was CHCF, California Healthcare Foundation, and is now being funded by Kaiser Permanente Community Health. But these two learning networks, I will be leading the one in San Diego, and they're being funded by CHCF. So this is more just an opportunity for you to hear what we've been doing in LA and how we're structured. And thank you so much to Julia for putting this orientation together.
All right, great. So just a little bit about us. The National Institute for Medical Respite Care is a special initiative of the National Healthcare for the Homeless Council, like I mentioned. It began in 2020. In fact, this month is our 5-year NIMARC anniversary. Yay. NIMARC's primary purpose is to expand medical respite, also known as recuperative care, across the country by advancing best practices, delivering expert consulting services, and disseminating state-of-the-field knowledge about medical respite care or recuperative care. You can find out so much more about NIMARC at nimarc.org. There's the team there. We have a few joining us today, Krista, Samantha, and Bo. We'll be taking notes for this meeting. NIMARC resources. So we do a lot of stuff. We offer lots of resources for you, and we do research, offer technical assistance, one-on-one, assistance with program development, consulting services, and really our job is just to elevate the field of recuperative care across the country. And we also have a brand new updated medical respite program directory, which is growing every day. So again, nimarc.org is where you can find these resources. And NIMARC would not be possible. We wouldn't be able to do all the amazing things that we do if it weren't for the full National Healthcare for the Homeless Council, our parent organization, grounded in human rights and social justice. The council's mission is to build an equitable, high-quality healthcare system through training, research, and advocacy in the movement to end homelessness. Our organization is doing a lot of amazing work, and there's a website there. You can learn more about what it is that we do. All right, moving along. Today's agenda, Pam's going to start us off talking about the history and the achievements of the LA Recuperative Care Learning Network. And then I'm going to go more into the format of the Learning Network model, what you can expect as far as attendees and topics that we're going to be discussing during the Learning Network meetings. And then Pam and I are going to talk about kind of the additional Learning Network groups and activities that come along with the Learning Network, as far as like the advisory group and extra work groups to work through issues. So we'll get into that towards the end. And then for the last 20 minutes, we are going to break out into rooms by region. So we'll have an Alameda County room and a San Diego County room. So you will be able to choose which room you'd like to go to. And we'll talk more specifically about what's happening in your region as far as the schedule and the next steps for the Recuperative Care Learning Network. Just a little bit of housekeeping here. So we're going to ask that you please remain muted for the main presentation. Comments and questions are always welcomed in the chat. Krista, if you could let me know if any questions come up, I'd be happy to answer them. In the breakout rooms, we absolutely want you participating in the discussion and ask questions, please. And also, yes, slides and the link to the video recording will be sent out to the attendees after the meeting. So if you missed it or your colleagues missed it, you'll be able to share what we talked about today. So I'm going to hand it over to Pam right now to tell us about the LA Recuperative Care Learning Network. Pam.
Okay, let's go to the next slide. So I just noticed that Dr. Michelle Schneiderman with the California Healthcare Foundation is on this meeting. And so, Michelle, I don't know if you wanted to say a couple words about the incredible support and how you personally helped get this started in LA, and you've been, funding it for 2 years, and now you're back funding the San Diego and the Alameda County Recuperative Care Learning Network. So I don't know if you wanted to say a couple words.
Uh, Thanks, Pam.
Yeah,
I wasn't really prepared to say anything, but
that's
hello, everyone.
okay.
Thank you for showing up. I am so excited that we are launching these two new learning networks. So yeah, several years ago now, right when CalAIM was launching, we worked with several stakeholders and partners, some of them here on the call today, in Los Angeles to try and understand the needs of all the various players. Um, and what came out of that was a real desire to bring together partners from across various sectors, managed care plans and providers initially, and then hospitals eventually, for the purposes of of learning together, of better coordination, of um, you know, oversight, accountability, transparency, as we were launching CalAIM and this new way of financing recuperative care. I would say it was wildly effective. I think Nymark and Pam not only pulled together an amazing group of stakeholders, but through the process and working closely with Department of Healthcare Services at the state, we're really able to shape policy in addition to shaping the way that care was delivered and coordinated across the various partners. And still today, the plans show up. They bring their policies, their workflows, like things, right? The nitty-gritty is worked through in a very transparent way, and it's been incredibly successful. So I am excited to begin the journey in San Diego and Alameda, and very committed to the success of recuperative care going forward now more than ever, given what's happening federally. The
Yes.
opportunity to speak.
Yes, so thank you, Michelle. It has been extremely gratifying. Michelle funded our conducting interviews and focus groups back in the summer of 2021 to see if LA recuperative care facilities, the managed care plans, and the hospitals were interested in starting a learning network. And then she funded the learning network for the first 2 years. So none of this would have happened without you, Michelle. So we're extremely excited. And she's, doing the same thing with LA and Alameda. And so how this really started was Kelly Bruno, who was the executive director of National Health Foundation, which is a nonprofit organization in LA that was founded by the Hospital Association of Southern California. And I had negotiated contracts back in 2018 to do a pilot, and we leased up beds for the Pico Union property. And she literally called me up and said, "You're going to have to renegotiate our contracts, Pam, because of CalAIM. Would you be willing to help all the recuperative care providers?" So Kelly is now with CalOptima, and she runs CalAIM. So we sort of switched. I was formerly VP of LTSS and long-term care for Care First health plan, and then when Blue Shield purchased us with Blue Shield. So I led the CalMedi Connect Duals demonstration in LA and in San Diego counties. So really the what we've learned is, you're getting the benefit of us having gone through this for the last 3 years in LA. And we understand that every county is unique. You have other issues, and different politics, and all this plays into this. But really, the main purpose was to help facilitate successful partnerships. And, as you all know, that we had the whole person care pilot, and then, a lot of energy and financing went into setting for counties to set up the infrastructure. And then CalAIM moved that over to the plans. And so whenever you change the funding from one party to the other, whenever the managed care organizations get ready into an initiative, we literally, it's a lot of work. And so we are, obviously hoping that we can use some of the learnings from LA for both Alameda County and San Diego County. And here's a list of some of the activities. We were assisting in getting contracts with health plans, certainly advising on applications for capacity building funding. As you all know, we've had IPP funding, HIP funding, and Path Cited. And so we tried to get as many of the recuperative care facilities in San Diego County, help assist with and review their applications so that they could get funded to build out their capacity. A lot of work has been around resolving payer provider issues, specifically around getting the recuperative care organizations paid timely, and teaching them how to submit claims. Definitely sharing promising practices, and there's so many right now all over the state, with many great organizations that are doing things to try to help this vulnerable population. A lot of updates. We stay in the loop in all the different webinars with the state and local, and then providing one-on-one technical assistance on program development. Although now you also have access to Path TA funds that are available. So we try to do everything we can to help facilitate successful partnerships between the health plans, the recuperative care providers, and the hospitals. Next slide, please. So here is an example of some of the policy successes we had. I remember sitting at lunch with Michelle and just thinking, okay, how are we going to do this? We're running into a brick wall. And this was during the pandemic when all of our meetings were on Zoom. And so we had an in-person forum and brought down, some of you may remember J.C. Cooper that was running Medi-Cal, coming down and helping clarify some of the issues. But one of our most important successes was helping the state get the information they needed so that they could reduce the authorization turnaround time from the 5-day authorization to 72 hours. So this was a very big success, because what's happening is the hospitals, had to keep these individuals in their beds while they're waiting for an authorization, and the 5-workday authorization turnaround time was turning into 2 weeks sometimes, or longer. And it's just not acceptable to have these individuals stay in the beds. Extensive eligibility exclusions. We had in LA County, and I'm, seeing this some in different people that I've been communicating with in San Diego, where, plans have different eligibility criteria. They had exclusions. We had one plan in LA that had a long list of exclusions that really wasn't appropriate. And so a lot of education on what recuperative care is and what it is not. The managed care plans only accepting referrals from hospital inpatient or SNF. We were able to get the plans to agree to start accepting referrals from the emergency departments. And that was a big, big shift because trying, the hospitals and the managed care plans would like to be able to divert people out that are not appropriate and don't meet the criteria to go into inpatient. So if we can try to divert them and not have them go into hospitals, that's really important. And then we had, recuperative care providers and hospitals that, would call me up and say they're limiting the admissions to 2 per year. And those of you who are there working in recuperative care know that sometimes you have an individual that comes to your facility and they turn around and leave and go back to the street, in 2 days, and they come back. So we were able to get the plans to eliminate the 2 admits per year, understanding that sometimes there may be many admissions to get to the 90 days where people feel that they can trust folks. So there's a lot that goes into that. I'm in LA this week and been spending a lot of time at recuperative care facilities and talking to the people that are there. And, it's tough. It's very, very tough based on what they've experienced for them to, to trust that this is going to be it, that the recuperative care is going to help them get into housing and help them turn their life around. And then the hospitals were required to schedule PCP appointments, home health, a lot of things that really is not the responsibility of the hospital discharge planners. And so LA Care Health Plan is now leaving tasks up to the hospital or the recuperative care provider. So the other thing is have been successful in getting all of the health plans in LA County to accept presumptive authorization, meaning the hospital and the hospitals who know a lot about who's eligible because they have been paying for recuperative care for many, many years. They know who's eligible. And so the hospital discharge planner working with the recuperative care provider is able to transition them without an authorization. And then the recuperative care goes back to the plan to get the authorization. So this is just kind of a brief snapshot, and we are continuing to work with the state on some of the policy issues. Next slide. I think this is you,
All
Julia.
right. Yeah, this is all me. All right. Thank you, Pam. A lot of great things that have happened in the Learning Network over the last few years. So I'm going to talk a little bit about the Learning Network meeting format um, as we currently operate in LA County. Right now, the LA Recuperative Care Learning Network is a monthly virtual. We hold full network meetings. They were monthly, but now they're every other month because we're so far in. So they're 90 minutes long. The meeting structure is, fairly, basic in terms of, we have announcements. Oftentimes we'll have a guest presentation, somebody from the community that it works with recuperative care or, from the hospital or, it's a guest presenter. And then we'll have a scheduled discussion generally about policy has been the biggest topic lately, and how to implement the new community supports policies. And then we have an open discussion. So, really it's the attendee space to choose, what they want to talk about, what issues are important to them, and to, just have an open discussion with the hospitals, managed care plans, and recuperative care providers, and get everyone's perspective. And it really helps folks see where the other person is coming from or where the other stakeholders coming from. So yeah, so the meetings are great. Our attendees, again, recuperative care providers, hospital social workers, managed care plans, and really any other partner in health and homeless services is able to come as long as their work intersects somehow with recuperative care services in LA County. And that includes like interim housing providers too, so really anyone's invited as long as they're somehow involved in recuperative care. We average about 50 to 60 attendees per meeting. Our participants, you have to request to join the Recuperative Care Learning Network, and then we approve and send the link out. The reason why we do this is just to ensure that the meetings are, closed to outsiders, the right people are there, and we don't get any consultants coming in, or anyone trying to sell products, to the members. So it just really keeps it a safe space for really focused and honest conversations. So what makes the Recuperative Care Learning Network different? And I've heard this question as I've been exploring opening the recuperative care program learning network in Alameda County is, saying we have meetings like this, we've been to meetings like this, what makes it different? So the Recuperative Care Learning Network, is dedicated to regional, your region and the issues in your region. So we really are, hyper focused on recuperative care only, direct and open communication, as I mentioned before. Um, and as facilitators, and I can say this about Pam, she's way better at this than I am, but she does not shy away from uncomfortable conversations. It's because you got to talk about the tough stuff, right? And in order to really come to a point where you understand each other. And really, after having these uncomfortable conversations, people have much more respect for each other, and operations, just get more, get smoother. So, this is really important aspect of the learning network. Um, at our meetings, we don't try to identify challenges and barriers in coordinating recuperative care services, but we actually try to generate solutions and work on strategies, create workflows, whatever it takes to get to a place where everyone agrees on, a specific system or, process to make things work more smoothly. And we communicate with DHCS. So we advocate for policy changes. Most recently, Pam through the work at NIMARC has, successfully got, corrected the guidance about ADLs supports that recuperative care providers, the staff do not provide ADL supports. And that personal care and homemaker support community services should be used instead to bring outside caregivers in to provide those supports. So that's just an example of some of the things that we work on through the Learning Network. Okay, so I'll talk about these two, Pam, and you talk about the next two, okay? So with the Learning Network, we have a lot of other, branches out into a lot of other projects. Part of all learning networks is that there's an advisory group or an advisory committee. Currently the advisory committee in LA County meets every other month. It used to be monthly when we first started. And really the point of the advisory group is to determine the course and the content of the full network meetings. What should we be focused on? What's the latest news in recuperative care services? The advisory group is always comprised of, key stakeholders, people who have influence, on recuperative care services in the county that can make decisions, and just in general are knowledgeable about the recuperative care services in the county. So every group will have an advisory group. We'll talk more about that when we have our breakouts. And then secondly, just recently, the LA Recuperative Care Learning Network started doing kind of little side work groups, very small groups of just, meeting once or twice on a particular topic. For instance, today we have our second meeting of the Recuperative Care Collaborative Work Group that's talking specifically about the 6-month global cap on room and board services. That is in the updated DHCS Community Supports Policy Guide. And we're trying to figure out, strategize how to improve the process of tracking, create some workflows. So, but we're making really, actual progress on, creating a system that works for everybody. And these work groups are built from people from the LA Learning Network, people who want to just volunteer to do this extra work, and are really closest to the issue of focus. All right, Pam.
Okay, so I have shared some of this with some of the people that I've spoken with and interviewed in San Diego, but we started becoming aware that the number one reason that people that needed to be referred to recuperative care were not able to admit into recuperative care because they had functional needs. They had needed assistance with ADLs and IADLs. We were hearing this from, by the way, we have 225 hospital discharge planners and nurse case managers in LA that receive invitations and that attend. And, not all at the same time. Usually they're not all there at the same time, although we have great turnouts when we have our annual forums. And so Kaiser Permanente Community Health reached out to us and and said, we see that this is a real barrier. We'd be willing to fund a pilot project to see if we could, impact and influence policy change and get some clarification on what recuperative care providers can and cannot do. So this pilot, the launch of the pilot was delayed several months because the DHCS had put in their policy guide. For those of you that remember the original policy guide, it does stay in there that recuperative care providers need to provide some ADL and IADL assistance. And so DHCS, together with NIMARC, we reached out to the California Department of Social Services, Community Care Licensing, and we did receive a letter notice that stated very clearly, recuperative care, our facilities are unlicensed. And so at no time can recuperative care staff assist with ADL and IADL needs. They would have to be licensed as a residential care facility for the elderly, assisted living facility. But what community care licensing did share is there is no reason that outside caregivers can't go into recuperative care. Home health goes into recuperative care, some street medicine providers go in. And so because IHSS takes so long to do even when they do agree to do expedited assessments, getting an IHSS worker that can provide this care is extremely difficult, especially for unhoused populations. And so the gap filler as part of CalAIM is the personal care and homemaker services, which is a community support. And so we've just launched this pilot with Kaiser and Molina and Anthem in LA County. Very, very excited. One of the reasons we're moving forward with the pilot, even though we got some policy change at the state level, is to really fine tune the workflow. We were all set up to do presumptive authorization for recuperative care and presumptive authorization for personal care and homemaker services. And then now we got this global cap looming over our head where everybody's trying to figure out, how many days they've been there, et cetera. But, one of the things that I did hear loud and clear from the people that I interviewed and spoke with in San Diego County is that you want to be able to tap into the same resource. And this is available. You do not have to do a pilot. Right now, any health plan can authorize, in addition to the recuperative care, they can authorize a personal care and homemaker services caregiver to go into recuperative care. So that is one of the things that I'll be working with you on because it seemed like it was such a big issue. And there's no reason we can't benefit from what's happening in LA and San Diego as well, and actually statewide, because all of the Medi-Cal managed care plans in the state can now authorize the personal care to go into recuperative care. So we're really excited and so grateful to the participants that have hung in there with us because we've been talking about doing this and planning it for a year, and it's finally being launched. The other is, and I know in San Diego County that you have something similar through the 2-on-1 program that I think was also funded by the California Healthcare Foundation. We don't know what we would do without you, Michelle. But this bed availability pilot was funded by UniHealth Foundation, which is a healthcare foundation in LA. And what their charge was for NIMARC to either find somebody that could build a bed availability program or somebody that already had it, in their platform that they could let the health plans and the hospitals know which facilities have beds available and are they male or female. And so this pilot is currently being implemented with hospitals and recuperative care providers in LA, not all of them. And we have asked them to adds short-term post-hospitalization housing because that needs to be factored in. As most of you know, the global cap that most plans are going to start with on January 1 of 2026, allows 6 months per calendar year for any combination of recuperative care, short-term post-hospitalization housing, and transitional rent. And so we are hopeful that this same platform will be able to track things and actually help the plans with counting the days. So these are 2 pilots that have been a part of the learning network, and I fully expect that in San Diego, who I'm going to be working with, that this is, you're definitely want to be able to benefit from the ADL in recuperative care pilot. So I will stop there.
Okay. Yeah, I have a feeling both of our learning networks, Pam, we're going to be talking a lot about the 6-month global cap on services coming up this summer. Okay.
Hey, Julia, it looks like you got a question in the chat. It says, are
Okay.
the health plans a part of the learning networks?
Yes.
Yes,
Okay.
they are. Yep.
Asked and answered. Thank you.
Thank you.
Yes, all 6 recuperative care or all 6 managed care plans are very, very active and very involved because we've been working with them on helping change their workflows and a lot of different things. So I don't know how you can do this without the health plans at the table.
Exactly. Yeah, so just real quick, I just wanted to make note of the annual in-person event that the LA Recuperative Care Learning Network hosts. We just had our 4th year, or we're in our 4th year. It's open to all the participants of the Learning Network, and it's an opportunity to get together, put the computers away, not look at people in boxes, but actually get to have time to network and just enjoy being together, celebrate achievements over the last year, continue those tough conversations, and showcase innovations and best practices. We always have a great time at the forum. And we are certainly going to, for the San Diego as well as Alameda County, going to have in-person event options as well. So we'll talk more about that when we break out. But yeah, I always love the forum. And now we are at time for the breakout groups. So when I hit the button, you'll be prompted to select either Alameda County with me or San Diego with Pam. Again, we'll meet for 20 minutes of the meeting to discuss really regionally specific the steps for the learning network in your region, what the schedule is going to be, and have the opportunity to ask a lot of questions. The meeting will end at noon, and we will not come back to the main room. So just wanted to let everyone know that. And then there's my contact information as well as Pam's in case you didn't have it. You're welcome to email us if you have any questions after this presentation. We'd be happy to answer them. So I am going to.
I was just wondering, Julie, if anybody had any pressing questions before we do breakout that are
Sure.
relevant to everybody.
Sure, that's fine.
We sort of spoke fast, gave you a lot of information. Didn't know. Okay, everybody's good. All right. Do your breakout thing, whatever that is, however you do it.
All right. All right. So again, you get to choose Alameda County or San Diego, and we'll see you all in a few minutes. Thanks.